To the webinar on drugs and decriminalization in Asia, global updates on drug decriminalization. It is the third in a series of webinars covering updates on drug policy reforms towards decriminalization and harm reduction in Asia. So first thing first, we have simultaneous interpretation in Thai and Indonesian languages, which is accessible if you join on Zoom. To access interpretation, please click on the button with the globe on it in the menu bar at the bottom of the Zoom screen, then click on either Thai or Indonesian. I am the moderator for the webinar today. My name is Unchisa Eaimtong. I work as the Asia Program Officer at the International Drug Policy Consortium. Today, we will hear from an amazing panel of speakers who will be sharing about developments on decriminalization in their countries and the implications for drug policy reform in Asia. We will open up the discussion to address questions from the audience at the end of all the presentations. Some people might be joining the webinar on Facebook as well, and if you have questions, please do write them in the comments or chat box on Facebook and Zoom. We will address them during the Q&A segment. Unfortunately, our colleagues from Canada and the United States couldn't join us live due to time zone challenges. Instead, we'll be showing their video presentations. If you have any questions for them, feel free to also write them in the chat or comment boxes, and we will forward it to them for a response afterwards. In the first two webinars, we explore recent legal reforms toward decriminalization and drug rehabilitation system in Asia. If you missed them, the recordings are available on the International Drug Policy Consortium's Facebook page. With this webinar, we're taking a broader view looking at how decriminalization models operate in different parts of the world. For years, governments in Asia have looked at outside the region, especially to Portugal, when considering decriminalization. So what happens there, as well as in Australia and North America, inevitably influences this region. We hope that this webinar will be a space for examining key issues and potential strategies for advancing reform efforts across regions, from North America to Europe to Asia. So to start with our discussion today, I'm delighted to introduce our first speaker, Joana Canedo, an activist for the rights of people who use drugs and an expert in drug policy, harm reduction, and public policies. Joana works with an intersectional approach to achieve efficient public policies, focusing on the engagement of women, trans women, and non-binaries experiencing multiple violence. She's a member of the executive committee of the European Network of People Who Use Drugs, as well as the campaigns coordinator and responsible for their peer-led research on HCV-related services. Joana will share insights on Portugal's decriminalization model. More than 2 decades since its introduction, this model remains one of the most cited by governments in Asia. We'll take a deeper look at how it has worked out while also exploring how the model has evolved over time. Joana, we look forward to hearing from you.
Hello, everyone. Good morning. So I'll try to share some slides. Let's see if I can make it. I don't know if you are able to see. No, not yet. Can you see the slides? No.
Yes, we can see it.
Yeah? Yeah? Okay. So just for having some guide. So I think, as you all know, Portugal decriminalized drugs, drug use and drug possession through the law 30/2000. So in 2000, back to 2000, and entering in force in 2001. This law brought us a lot of benefits in terms of health and social sphere, but it has been studied by us and also observed by civil society in general, some backlash around the main principles of the law. So at first, I will try by introducing the law and its frame. So the law 2000 defines the legal framework applicable to the consumption of psychotropic substances, together with the medical and social welfare of the consumers of such substances without medical prescription. So it means that it regulates the illicit drugs, not the synthetic drugs. The synthetic drugs were only regulated in amendments to the law, but now in 2023. So in 2000, Portugal has has done the decriminalization of drug use. The traffic has remained criminalized, as well as the cultivation of plants. The illicit substances remain illegal, but their use, possession, transportation, it's not a crime. It constitutes actually an administrative offense. One of the things that the law has done in 2000 was to settle the commissions of dissuasion of addiction. There is like different commissions by district. Locally, it means, and these commissions serve whenever people had until a certain moment what the state would consider the 10 day a diary for 10 days, let's say. It could be like 2 grams for cocaine, maximum tops, or 1 gram of heroin, 5 grams of hashish, 25 grams for weed. If the user had until these certain amounts, it will be there will be a referral from the police to these commissions of dissuasion of addiction that are like intersectional in terms of hosting their clients. So it means that there are psychologists, social workers, lawyers. And the point is here to understand whether a person has like a challenging, problematic drug use or a normative, let's say, use around. So in terms of data, one of the things that the state has also recognized and shared is that most people arriving to the commissions of dissuasion of addiction are non-problematic drug users. That means that from, according also to the general standards worldwide, 80 to 9% of the people arriving to the commissions of dissuasion of addiction have non-problematic use of drugs. Also, this law was followed by another decree law, 189/2001, that established harm reduction as one of the main pillars of the decriminalization law. So the law has like these 5 dimensions on prevention, dissuasion, treatment, harm reduction, and reinsertion. I will basically spoke more on the harm reduction part of it and also the dissuasion. The treatment, prevention, reinsertion is something that has been really steady through the beginning of the decriminalization policy. So we have access as users to treatment clinics. They are supported by the state or either they are by private initiative. The prevention runs in schools. The reinsertion in many phases. It's something that has not worked so well because we did had some for instance employment programs specific for people who use drugs. Nowadays they are like few. So back to analyzing the law 30/2000. It was actually, and it was said before, considered groundbreaking at European and global level. It reframes mostly drug use from a health perspective. So a person who uses drugs is not considered to be a criminal anymore. So there was a relief in the prison system. And then a person would have access to a health answer in terms of treatment or harm reduction initiatives. Like for harm reductions, for instance, the law 189/2001 establishes like info points in party settings. It established drug consumption rooms that actually just came to light in 2019, the first mobile drug consumption program, because it was depending always on the municipalities and not on the, let's say, the willing of the government, but more on the responsibility of the global local government to enable the establishment of drug consumption rooms. Nowadays we have 3 in Lisbon, including one mobile van. We have also another one in Porto. This also brings some problems in terms of the distribution of harm reduction services that are mostly based and located in Lisbon and later Porto, and not in the other cities or spots in the country. It's very asymmetric in the way harm reduction is conceived. But actually, like in terms of main gains, so we can point to reduction in high risk drug use prevalence in Portugal. By the time in the end of the 90s, there was like a huge problem, challenging problem of people injecting heroin. It was almost 1% of the it was 1% of the population. That brought us to a lot of overdose cases and a huge rate of HIV infections. Nowadays, the rate among injecting drug users, also because the patterns change. So we can say that we get more people smoking, with challenging use, smoking drugs rather than injecting nowadays, which is also challenging for the establishment of drug consumption rooms that are equipped with smoking equipment and space more than the injecting part, let's say. Because this brought us to a residual tax of HIV infection among people who use drugs. These were like the most benefits that we can still look at it. So it had some legal ambiguities on judicial interpretations because the Supreme Court did a backlash, let's say. In 2008, the Supreme Court considered again crime for possession. It means that if you pass the allowed quantities for drug possession, you would be committing a crime, and either this could represent again legal challenges in terms not only of fines, but it could happen that a person could go still into a more severe let's say punishment by the court. So there are new amendments to the law. It's law number 55 2023, and basically it clarifies that the possession for personal consumption remains decriminalized. The cultivation of plants remains criminalized. It also ensures individuals with drugs for personal use, it means with drug possession for personal use, are not criminally charged. So here the quantities are quite deleted, and what has to be proven by the court in case there is suspicious of traffic, let's say, it's that the person is not using it for self-consumption. We don't know the impacts yet of these changes because it's very recent. So either one of the two. So it releases more the crime. So it means that if I get, for instance, 50 grams of weed for my personal use, or let's say 4 grams of cocaine, if for my personal use, if it's only for my personal use, I'm free of charge or any criminal offense, and it's only administrative as well, because there was some problems in looking at some specific cases that people would prove it was for self-consumption, but still being criminalized because it was over the quantity allowed by the law. So this law basically enabled us to display many harm reduction initiatives. I was lucky enough to work in the first safer consumption program, mostly directed to people who inject drugs because it was a mobile consumption room. And one of the things that this has been allowed us as harm reductionists was to settle the engagement of people who use drugs in the service delivery. So we had like a peer bursary just to have an example. How can also we foster participatory models inside something that is more top-down institutional? It opens all this space for working with people who use drugs. So we had like a peer bursary that allowed us to employ and to innovate in the outreach initiatives. This is part of the Euro Input peer-to-peer harm reduction series. I will show you more in the end. However, the stigma remains very strong towards people who use drugs, apart from the efforts to actually come to another vision, let's say. So people are still considered by the state drug addicts. There is like this vision that breaks a bit the ground in the society. Even if we get actually a thesis on the normalization of drug use, there is still a lot to do towards the stigma. The dissuasion intervention targets users, as I said, but still, if we look at the dispositive, and me personally, if I think, okay, I'm going to a commission of dissuasion of addiction, it's not a criminal record, but it's something that can be heavy in my daily experience, let's say, not softening. Then Portugal participated as one of the countries for the Global Drug Policy Index. As you can say here, there is no extrajudicial killings or anything like this, because the sentence, it was to reduce the criminal. The point was to reduce the criminal sentence. So the human rights is a very huge approach over here. We stand for the dignity of people who use drugs, and even like the time in prison are very reduced since the law entered in force. Even if we can feel some backlash towards police violence on people who use drugs, and that's why the question of the stigma. And still we have some points here under, for instance, a military police that is still kind of enforced in the more countryside parts of the country. We have harm reduction, as I said, but it's not properly funded, so it's only funded at 80%. We do have access to OAT and other substitution treatments, but basically people are very engaged in methadone programs, in low threshold methadone programs that are sometimes work as must have a social control tool. Just to say, and now for the backlash, what I wanted to say is this. So last week, like a few colleagues from NGO and also people who use drugs joined to make a statement that the policial repression is being higher on the drug users.
Sorry, Joanna, just to say that you have 1 minute.
Okay. And it's being very, very visible, like in terms of media, shocking news and others to backlash. For instance, the mayor of Porto had a talk about criminalization of drug use again. The drug consumption rooms are under surveillance sometimes of the police. The collaboration of dissuasion, it means the collaboration in the different pillars has not been working so well. So in these terms, we don't know what the future brings, because there is also a lot of risk on the far right speeches towards people who use drugs and migrants as well. So we would like also to train our police forces. It's something that was lacking from the beginning, so we can all kind of speak of the same language. But I guess also input as this report that I leave here just to note on the criminalization policy from the user lens. And it says also we need to think about legalization and regulation in order to put an end to stigmatization, discrimination, and social exclusion. And here some best practices, and you can find also some Gatin Moraria HCV center, drug consumption room, and peer-led with peer-led valencies based in Lisbon, and the peer-to-peer needle and syringe program and the naloxone distribution. We do get access to naloxone, but we start with a lot of civil disobedience and private funding for these that should be accessible actually for a national program as well as for the drug consumption rooms. This is still lacking. So yeah, thank you. I'm available for your questions at the end.
Thank you so much, Joana, for the insights. So Portugal's decriminalization model has been in place for a long time, and so it's important to keep revisiting it as the context evolves to ensure that we continue learning from its experience. As there's no perfect model, and every model has its own progresses and challenges that remain. So, our next speaker is Nick Boyce, who is the Canadian Drug Policy Coalition's Policy Director. He has worked as the Gay Men's Harm Reduction Coordinator at the AIDS Committee of Toronto, as the provincial trainer with the Ontario HIV and Substance Use Training Program, and as director of the Ontario Harm Reduction Network. He is the current liaison with the Government of Canada for the Canadian Civil Society Working Group on International Drug Policy. Unfortunately, Nick cannot join us live, but he kindly recorded a video discussing the recent decriminalization pilot in British Columbia in Canada and its outcome. Let's take a look. And please give me a minute to try to open the video. All right.
Hello, my name is Nick Boyce. I'm sorry I could not join you in person, but hope this presentation can provide a bit of background and context to drug decriminalization efforts in Canada. And I'd be happy to try and respond to specific questions at a later time. And with the Canadian Drug Policy Coalition, we advocate for evidence-based, human rights and social justice-based drug policy. And I've been working in drug policy and harm reduction for about 25 years. I was born in England, but I have lived in Canada most of my life, and I currently reside in Ottawa, the capital city, which is on the unceded territory and home of the Algonquin Anishinaabe people of Turtle Island. Before I talk about what has happened with respect to drug decriminalization in the past couple of years, I'd like to provide some history and context. While many people think of Canada as a progressive, diverse, and harmonious country, which in many ways it is, we also have a dark colonial, racist, and classist history, the impacts and legacy of which continue to this day. We're about a country of about 40 million people. We have federal drug laws, but most of those drug laws have been, most drugs have been criminalized due to various social reasons and not for health reasons. The Canadian drug laws have always been tools of surveillance control and colonial nation building. Despite huge investments in law enforcement and policing, we have never stopped the supply of drugs, and actually the supply side interventions have created this toxic and unregulated drug supply. We've seen it move from opium to heroin to fentanyl, and now we're getting real mixtures of different types of drugs, including benzodiazepines and vet tranquilizers. It really is completely volatile and unpredictable. And prohibition has not addressed the demand and reasons for people using drugs. And our Canadian drugs and substances strategy is heavily weighted in terms of funding to law enforcement, which receives more funding than prevention, harm reduction, treatment, and research combined. Over the last 8-9 years, we've lost almost 50,000 people just to opioids. Last year, every single day, 21 people were killed by unregulated opioids. It's important to note these are unregulated drugs. These are not prescription drugs that are killing people. As well as opioids, we hear a lot about opioids, but also stimulant deaths. We saw 9 stimulant deaths a day. And then on top of that, there's all the hospitalizations, emergency department visits, the paramedics, huge strains on healthcare. So that's some context for what happened in British Columbia. Increasingly, was this unpredictable, increasingly toxic, unregulated drug supply, killing people. There's an increasing understanding that stigma was keeping people out of accessing healthcare. They'd had experiences in British Columbia with Insight, an injection site, a supervised injection site for 20 years. It had been running with lots of success. We're increasingly seeing evidence coming out of Portugal around the benefits of decriminalisation there. Really important to note, though, that the unregulated supply is a vastly different situation in Portugal compared to what we're seeing here in Canada. We also had, a couple of years ago at least, support at various different levels of government from the public, and even the chiefs of police were supportive of this. A critical piece to all of this, though, was the timing. When it was implemented in 2023, this was post-COVID, and there'd been a significant increase in homelessness as a result of the COVID pandemic. So in Canada, we have federal drug laws, and under those drug laws, you can apply for what's called a Section 56 exemption, which means that those laws don't apply in certain situations. So the province of British Columbia, that one province out of many across the country, applied to the federal government for an exemption. So as of January 31st, 2023, that exemption was implemented, and it was for a 3-year pilot project. And what it meant that if you possessed up to 2.5 grams of opioids, cocaine, methamphetamine, or MDMA, you would not be subject to criminal charges. Importantly, it did not include other drugs like benzodiazepines, amphetamine, cathinones, and there's lots of reasons why that might be. What that meant is that for personal use in private residences, homeless shelters, drug consumption sites, you would not be arrested or charged or even have your drugs seized. And the intent is that you'd be offered and referred to treatment and other supports. But public drug use was still is illegal in public spaces such as hospitals, transit, parks. Youth are not exempt from this. Youth cannot control drugs. And it doesn't mean the drugs are legal. You can't sell them in stores, import them, traffic them. Some of the concerns with the model, though, was very tokenistic consultation with people who use drugs. The police input was valued much more so. People who use drugs said the 2.5 gram limit is just not enough, considering usage and buying patterns. They suggested 4 grams. Lots of other concerns in terms of maybe more charges for possession instead of for trafficking instead of possession, and trafficking is a more serious offense. This might incentivize more potent drugs. Again, youth not addressed. There's been a lack of training for police, lack of procedural transparency and accountability. And then there's local and municipal elections and politics that got in the way. We didn't see a significant shift in financial resources from police to health. And actually, we've seen increased police budgets. And there's been a lack of health and social services type of outreach. We did see some positive outcomes, though. A 76% decrease in simple possession. That's good. Less involvement with the criminal justice system. Use of drug checking services increased 60%, and we saw increasing access to other harm reduction programs. However, there were lots of unanticipated outcomes. There was real public misconception and conflation of increasing homelessness with the decriminalisation pilot project. Governments did not communicate clearly around what the purpose of decrim could be. And many people thought it would reduce overdose deaths, but we've done nothing to address the toxic, unregulated supplies. It was never going to reduce overdose deaths. There's been politicians have jumped on this. There's increasing political rhetoric and anti-poverty backlash. We're seeing new bylaws, even though public drug use is illegal under this decrim. We're seeing other levels of government try to implement even further restrictions on public drug use. And the city of Toronto, the biggest city in Canada, had also applied to the federal government, but they were denied their application because they were citing the public safety concerns that they were seeing from British Columbia. Where are we at in 2025? We have had recent provincial elections and some more upcoming, and we have a federal election by the end of 2025. But we're seeing, the political rhetoric is really ramping up. Drugs are becoming a significant election issue. We're seeing people campaigning on stop the drugs. They're wanting mandatory treatment, mandatory minimum sentencing. And now with the US election and the threat of tariffs, in the last couple of weeks, in the last couple of months, we've seen Canada really ramping up the war on drugs, investing $1.3 billion in border security, appointing a fentanyl czar. So is criminalization dead? No, but it has definitely been set back. Most Canadians still favor a health-centered approach. However, what the future holds, I don't know. But what we have come to realize is that decriminalization on its own cannot undo over 120 years of prohibition in Canada. In less than 1 or 2 years, it's not going to significantly shift resources to social determinants of health. It doesn't create housing and treatment overnight. And critically here in North America, it does not address the toxicity of the unregulated drug supply. So decriminalization is necessary, but it's not sufficient. In 2023, the United Nations Office of the High Commissioner for Human Rights called for member states to consider responsible regulation. And that's what I think we need to do. Responsible regulation will not solve addiction and related health issues. We just see that with alcohol, but at least people are not dying from poisoned and toxic drug deaths, and we're not having to spend all the money on the enforcement side, and that money that's currently being wasted and driving the toxic drug supply from the enforcement side could actually be used on housing and mental health and job creation. So it's really, we could go full on commercial production or all the way to the death penalty. There's a regulatory continuum. And what we're trying to think about is, where do we balance the illegal market versus the legal market, minimizing corporate profits and gang violence and really centering public health. But right now the efforts in Canada have been set back, but we're going to continue. And one last thing, there was a community-led group called the Drug Users Liberation Front. They tried a project where they had about 40 people that were part of this club. They were 19 years old, had to be at least 19 years of age. 68% of them had a history of overdose. Those members could purchase drugs that had been tested and labeled and acquired from the unregulated market, but they'd been tested. Not one person overdosed in the time that this project was running. They did apply to the federal government to start doing this more legitimately, but they were denied that exemption. And then the founders have even now been arrested and are now facing criminal charges. So that's a sense of where things have gone in Canada. Happy to try and answer questions. If you would like to submit those to the facilitators, I'll try and get back to you at another time, and just appreciate the invitation to come and speak today. Thank you.
So once again, we'd like to thank Nick for taking the time to give us an overview of British Columbia's decriminalization. As Nick highlighted, decriminalization is necessary, but it alone is not sufficient. So it's crucial to continually explore better and more creative responses to adapt to decriminalization effectively and to truly improve social and public health outcomes. And Nick also highlighted key points about the unintended consequences of decriminalization, particularly public misconceptions and political rhetoric against the pilot program. A striking example of how such misconceptions can influence policy is Oregon's decriminalization effort, which was introduced in 2020, but later rolled back in 2024 due to similar concerns and misunderstandings around decriminalization. Another speaker who cannot join us online today is Dasha Naidu, who will share about what has been going on in Oregon, USA. Dasha is Managing Director of Foreign Policy Advocacy with the Drug Policy Alliance and an expert and strategist in the area of drug policy reform. Naidu has pushed for the creation and adoption of innovative drug policy reforms, including playing a key role in advancing policies and practices to reduce the role of criminalization and promote a health approach to drug use. I will share her video presentation in a few seconds.
Greetings. My name is Teshia Naidu, and I work at the Drug Policy Alliance, which is a US-based organization that works to address the harms of drug use and drug criminalization through policy solutions, organizing, and public education. Thank you for the opportunity to talk about Measure 110, which was a citizen-led initiative approved in November of 2020 by voters in the state of Oregon, USA. The measure passed with 58% of the vote and made Oregon the first state in the United States to decriminalize possession of small amounts of controlled substances. The law also identified dedicated funding to expand access to health and recovery services. Unfortunately, after a concerted disinformation campaign by opponents, politicians voted in April of 2024 to undo key aspects of the reform and reinstated criminal penalties. Sensational media reporting that blamed rising overdose deaths with decriminalization fell short on the context necessary to understand what truly happened in Oregon. I will provide more of that context and some lessons learned drawing from my experience as part of the team that authored the measure and worked on the campaign to pass and implement Measure 110. First, to summarize what the initiative achieved, I will do that and then focus on lessons learned from the Oregon experience. A primary goal of Measure 110 was to shrink the role of the criminal justice system as a response to drug use, and instead to treat it as a health issue. Measure 110 achieved its primary goals. Arrests for drug possession declined substantially after the law took effect in February 2021, resulting in thousands fewer people that were saddled with criminal records for low-level possession. Measure 110 also increased health and social services for people who use drugs and expanded to areas of the state where these were not previously available. In fact, over $300 million was allocated in the first 2 years of implementation, resulting in dramatic increases in the number of clients accessing services, a whole host of services such as screenings, treatment, peer support, harm reduction, housing, and employment. Measure 110 also saved $40 million in diverted criminal legal system costs, and these funds were reallocated to expand services. Despite these important developments, a number of external factors complicated the implementation of the measure. First, the proliferation of fentanyl, which is a powerful synthetic opioid. The proliferation of fentanyl in Oregon's drug supply resulted in an increase in the rates of fatal overdose right as decriminalization took effect. To be clear, independent research from separate studies found no link between the decriminalization policy and rising overdose deaths. The researchers concluded that the overdose crisis was driven by fentanyl, similar to every other part of the US grappling with this new substance, this synthetic substance. Another confounding factor was the historic shortage of affordable housing in the state of Oregon, and certainly in some of the largest cities like Portland. And 4 months after decriminalization took effect, the state ended its pandemic-related protections from eviction, driving an increase in the numbers and visibility of unhoused folks, resulting in an increased visibility of public drug use. The homelessness crisis and rates of overdose stem from a confluence of factors unrelated to the law change. Unfortunately, these external factors have been exploited by those committed to a punitive approach, and decriminalization was scapegoated for these social problems, facing increased pressure to do something about them. And these were unrelated to decrim. The legislature chose to roll back the decrim law and reinstate criminal penalties. Just to touch quickly on implementation issues, law enforcement, who historically have used one tool, which is arrest, as a response to drug-related issues, needed education in what a health approach looks like. Active opposition to Measure 110 from police agencies, who are the street-level implementers, it was severely problematic. Future decriminalization efforts should carefully consider the role that police play and maybe focus on developing a health-based outreach team approach to engage people who use drugs. Also, in the absence of a social safety net, persistent problems such as homelessness may be a convenient way to scapegoat decrim policies. It's important to stress that drug decrim is a pathway to public health. It is not and cannot act alone. It is not the solution. Other services such as housing, education, and employment are crucial, and decrim is only one component. Also, reshaping existing systems is very important to the policy's success. System change takes time, and it's important not to rush a paradigm shift in its early stages. Unfortunately, politicians chose to blame Measure 110 for problems that resulted from decades of failures and neglect to resolve larger structural and social problems. Despite the political impatience with Measure 110, we know from decades of experience that criminal penalties are not the answer to problematic drug use. The experience in Oregon also highlights the need for safer supply, drug consumption facilities, and highlights why legal regulation based on health and human rights is essential for a true public health approach.
So we would like to thank Teshia for carefully explaining the situation and systematically debunking the misinformation surrounding decriminalization in Oregon. It's easy to blame decriminalization for broader social issues, but the real challenge lies in tackling the structural barriers that prevent people from accessing the resources and services they need. Next, we'll take a look at the recent decriminalization model introduced by the Australian Capital Territory, or the ACT, which is where Canberra, the capital city, is. With this, let me introduce our next speaker. Chris Gough is the Executive Director of the Canberra Alliance for Harm Minimisation and Advocacy, an alcohol, tobacco, and other drug service delivery and advocacy organization run by and for people who use drugs and people who use drugs treatment services in the ACT. Chris is also the president of the Australian Illicit and Injecting Drug Users League and identifies as a person who uses drugs. Chris, the floor is yours.
Thank you very much, and thank you for having me. I'm just going to try and share my screen. Can everyone see that?
Yes.
Yes, great. Sorry, I can't see anything except my presentation. So, okay. So first of all, I'd like to acknowledge the country from which I'm speaking from. I wish to acknowledge the traditional owners of the land from which I'm speaking today, the Ngunnawal people, and pay respect to elders past and present. I also want to acknowledge that this land was never ceded and always was and always will be Aboriginal land. So just some broad context about the situation with harm reduction in Australia. So Australia implemented needle and syringe programs quite widely in the 1980s in response to the HIV crisis in Australia. NSPs in Australia provide sterile injecting equipment, and in a lot of locations, primary NSPs also provide health promotions, safer using and other harm reduction information, and pathways to hepatitis C testing and treatment. We also have 2 supervised injecting facilities in Australia, one in Sydney in the King's Cross, which was opened in May 2001 in response to a period of very strong heroin in Australia that was having some significant impacts on increasing overdose rates during that period. And then later on in June 2018 in Melbourne, in Richmond, for the same reason. As well as this, we have naloxone programs. We've had naloxone programs in Australia since 2011. They were first implemented by CAHMA and then spread across all of the jurisdictions in Australia. Australia has 7 jurisdictions, states and territories, and then a federal government as well. And so we have laws on the federal level, but then also jurisdictional laws. At the moment, we have a federally funded supply of naloxone, free to all jurisdictions, and then access is through states and territories on the ground that can actually implement the access to that medication. You know what I mean, overdose reversal drug. We also have some drug checking services and festival-based harm reduction. There's a service called DanceWise, which is a peer-based service, which has functioned for many years in New South Wales and Victoria, and is run out of Harm Reduction Victoria and New South Wales Users and AIDS Association, which are CAHMA's sister drug user organisations in those jurisdictions. We also have, currently, we have 2 fixed site drug checking services, Canberra Test, which is the ACT drug checking facility, which opened in 2022. And that happened after Pill Testing Australia did some festival-based drug checking trials, and they were evaluated in 2018 and found to be effective. 2 services in Queensland called Q-Check, one in the Gold Coast and one in central Brisbane, have been operating since 2024, and festival-based drug checking has also operated in Queensland since 2024, and more recently in Victoria, festival-based drug checking began just this year in January with a fixed site drug checking service beginning at the end of July 2025. As well as that, in New South Wales, the Medically Supervised Injecting Centre, in collaboration with the Loop, has been doing a residue testing trial since 2024. And recently we had a big New South Wales drug summit, and after that summit, the government announced a drug checking trial in New South Wales. So quite a lot of movement on the drug checking front, which is fantastic. So going over to drug law reform started in Australia in the 80s with expiation notices for cannabis. The first one started in 86 in South Australia with a cannabis expiation notice, followed by the ACT in 1992, which was the simple cannabis offence notice, which was a fine instead of getting a possession charge for cannabis. Throughout Australia, there are now some different cautioning and education systems, and then in 1999, a federal group called COAG brought together a nationally consistent drug diversion program, and to this day, most of them are still just for cannabis. There are some diversion programs for other drugs running across other jurisdictions, but there's quite a low level of uptake, and it's very cautiously applied. So more recently, since about 2016, we've seen some more reforms come into play. These have been born out of an understanding that actually drug policies are harmful as well as drugs. Drugs themselves, yes, they can be harmful to people, but actually the drug policies themselves that we implement can be harmful as well. They can cause harms in terms of criminal records, employment. They can destroy relationships. They foster stigma and discrimination, and they position people who use drugs as others in society. So the recent reforms have been born out of the government, social and police understanding that drug use should be treated as a health issue and not a criminal justice matter. And for cannabis only, I think there's also been a move that cannabis can actually have positive effects and medicinal properties. So the reforms that we've seen come out of these motivations. So in 2016, medicinal cannabis was federally legalized under a prescription system, a special access program of the Therapeutic Goods Administration. And then in the ACT, we saw a significant piece of cannabis law reform in January 2020. And then in 22-23, a partial decriminalisation of personal drug use for small quantities of some drugs. I'll be talking about those two in a little bit more detail in a couple of minutes. In Queensland, we've seen an increasing of diversion programs to include other drugs other than cannabis, although we've just had a change in government in Queensland, and the party that's assumed office has promised to get rid of those diversion programs. In New South Wales, we've seen last year an increase in diversion programs for other drugs. In Victoria, there's currently a push for decriminalisation of personal cannabis use in line with the ACT 2020 reforms. And as I mentioned before, the New South Wales Drug Summit has just concluded. We've seen a drug checking trial planned out of that, and decriminalisation was recommended in the report, but the government is still staunch in its opposition to decriminalisation. So just take you through the ACT drug law reforms. In ACT, in January 2020, we had a really effective piece of legislation change. Essentially, they inserted an over 18 exemption into the current ACT cannabis law, which meant that people over the age of 18 in the ACT could grow up to 2 plants per person with a maximum of 4 per household, and possess 50 grams of dry weight cannabis or 150 grams of wet weight cannabis with no police discretion. So there's no police decision making there. You are simply allowed to possess up to 50 grams of cannabis and grow 2 plants or 4 per household. In 22-23, so it was in October 2022 that the legislation was brought into law with a 1-year implementation plan before the law actually took effect. So it took effect in October 2023, and that was a partial decriminalisation of personal drug use. So this built on the 1992 simple cannabis offence notice, and it comes in the form of a $100 fine or diversion to a 1-hour health assessment for small quantities of certain drugs, certain common drugs. This required them putting a new small quantities threshold into the law. In the ACT, we have an evidence-based threshold for possession under which you're charged with possession and over which you're charged with trafficking. The political powers that be thought that this, because it's evidence-based, it's actually quite, it's actually a lot more than the federal laws, for example. And so they decided that it would be a step too far to use those evidence-based possession thresholds. And so they implemented these small quantities instead. They also, that actually meant that there was a gap between the small quantities that you can possess and the threshold for trafficking, which meant it is still possible to get a possession offence But in the midst of this law reform, one of the significant changes was that they reduced the maximum time of imprisonment for drug possession from 2 years down to 6 months imprisonment. The other difference with the cannabis law reform is that police discretion is involved in this one. And so you still can theoretically be charged, and not even theoretically, you can be charged still, even if you have under that small quantity, if the police deem that it's necessary to do so. So here, I just wanted to start with, these are the possession limits for the ACT in the middle column. So under 10 grams of MDMA, you get charged with possession, and over, you get charged with trafficking. You can see on the right-hand side the federal limits. You can see there's quite a significant difference between the two, which was one of the reasons that they decided to make another smaller threshold. CAHMA advocated very strongly, and in fact had a significant number of research and advocacy partners in trying to get the government to use the possession limit or the trafficking threshold instead of putting into practice another small quantity, but we were unsuccessful in that regard. So these are the new small quantities thresholds. You can see that they're quite, they're significantly reduced from the evidence-based possession threshold. So 1.5 grams for amphetamine, 1.5 grams for cocaine, 1.5 for methamphetamine, 1.5 for MDMA, 50 grams for cannabis, 150 grams for harvested cannabis. Now that only applies to people under the age of 18 because of that 2020 legislation that allowed adults over the age of 18 to actually possess cannabis with no police discretion. So that is just included for people under the age of 18. Heroin at 1 gram, and then LSD and lysergic acid at 0.001 gram, or 5 distinct units, which are like tabs or capsules. Again, there's not a lot of scientific or research evidence behind that 5 DDUs. That was something that was more political. You can't see the psilocybin. It's 1.5 grams. So in these changes, the Eston change in particular, there was a pathway created to divert people to health assessment or to a fine. There's been a couple of hundred people put through the system so far. The majority of people have chosen the fine. And that choice happens at the point where a police person pulls you up and sees that you have drugs. If they deem that the drugs are under the quantities that I showed you before, they'll confiscate those drugs and then ask you whether you want a fine or whether you want to be diverted to a 1-hour health assessment. The health assessment is conducted by the Government Health Service, the Canberra Health Service, and it's an assessment that talks broadly about your needs in terms of drug treatment. There's nothing mandated about it. If you do fail to turn up, though, you will be flicked back to the police to be issued with a fine. As I said before, people can still be charged with drug possession for amounts more than the small quantities, but less than the trafficable quantity. The other thing is that the police still have the discretion to charge you under the federal law if they deem that it's necessary to do so. Again, one of the things that was really excellent about this is that maximum possession charge being reduced from 2 years imprisonment to 6 months. So these are some of the guides that we handed out. The laws when it comes to combination amounts are actually quite challenging to interpret for people. And so we put out some brochures for the community so that they could work out what they were allowed to possess and what they weren't. And so broadly speaking, what it is, it's based on a percentage. So you can have a maximum number of, you can have more than one different type of drug. So for example, I could have 0.5 grams of heroin, that's 50% of my limit. And then I could have 0.5 grams of cocaine, that's 33% of my limit for cocaine. And so I'd be sitting on 83%. So I'd be allowed to have another whatever it is, 17% of another drug on top of that, in order to still be eligible for that simple drug offence notice. It's a poster that we produced. So since then, one of the really good things, I think, in both pieces of legislation is that they've both had mandated reviews. The ACT Cannabis Review has just been released. It was an internal government report. It was actually really heartening to see the level of engagement with community that happened during both of these processes, actually, and with the review processes. And it found some really positive things. Found that the rates of cannabis use have largely remained stable, and in fact have reduced, according to the National Drug Strategy Household Survey. They've reduced in the ACT from just over 10% to just over 18% for people over the age of 18 who have used cannabis in the last year. People in the ACT continue to be less likely to have recently used cannabis than the national average, and these dot points are taken straight from the report. The report is on the internet, it's on CAHMA's website, and very happy to share those details with you. The charges laid for cannabis offences and diversions have continued to decline to very low levels, and we're talking about a handful, reflecting a significant change in policing practices in line with the intent of the Cannabis Act. There's been no increase in charges laid for trafficking or cultivation offences since the commencement of the Act. There does not appear to have been any substantial increases or decreases in cannabis-related presentations to ambulances and hospital presentations. The secondary data is inconclusive on any impact on treatment seeking for cannabis, and there's no evident changes in the price and availability of cannabis. So there were some big concerns that people had, and in these cases, we just have not seen that come to fruition, which is great.
Chris, just to say that you have 1 more minute.
No worries. So from a community perspective, we've seen really significant reductions in stigma and discrimination around cannabis use, and a significant increase in trust between people who use cannabis and the police, which has been really fantastic. There have been some issues with theft of cannabis plants from people's backyards, and people have been able to ring the police and get help for those, which has been fantastic. There's also been a significant increase in people's willingness to talk about cannabis use to friends, family, and health services. And CAHMA's seen a 4-fold increase in people coming in to seek help if their cannabis use has become problematic for them. The impacts of the Drugs of Dependence Amendment, the Simple Drug Offence Amendment, which is for small amounts of common drugs, is only a year and a couple of months old. An independent evaluation is now being conducted into the law reform to assess whether it's had the intended effect of diverting people away from the criminal justice system. The evaluation is being conducted by the Drug Policy Modelling Program with input from CAHMA and the Australian National University, and the evaluation is due for completion mid-2026. The important factors in the ACT reforms that we found were really helpful and really good were positioning the affected community as leaders in the reforms, and inclusion in the decision-making process absolutely critical. And that included having strong leaders from community, from people who use drugs, talking and telling their stories in the media and reassuring people and telling them what the changes were all about has been absolutely pivotal. We have seen we saw real pushback in the media prior to the legislation. The sky is going to fall in, but we haven't seen that pushback post-reform, thank goodness. And I still have my fingers crossed. And when I hear stories coming out of, as we just saw from the two previous presenters, I really start to worry. The pragmatic approach by the police, following the intent of the legislation as opposed to the nitty-gritty of the strict letter of the law, has been really, really excellent and really pivotal. There was a lot of training conducted by the police, especially around drug use being a health issue as opposed to a criminal matter, and exceedingly important in the success that we have seen to date. Building networks of people who use drugs and police officers, although very scary for us, has been really important to make sure that police and the rest of the community and people who use drugs are all singing from the same song sheet. And I think one of the most important things is that we are evaluating and monitoring the law reform. I think that's crucial. As I said, the response in the media, yes, they thought the sky was going to fall in. We haven't seen that. Cross our fingers that we don't see a similar concerted campaign as the two previous speakers have talked about. And I'll leave it there. Thank you very much for your time.
Yeah, thank you so much, Chris, for providing a very comprehensive overview of not only what's going on in the ACT, but the whole country. It's amazing to see different harm reduction programs being implemented in Australia to address different challenges that arise. It also shows that data that form strong evidence are essential for advocating for reforms. And even after implementation, ongoing data collection is crucial to monitor and measure outcomes. Collaboration with various stakeholders is equally important, as a coordinated approach is key to ensuring effectiveness and achieving real positive results. And now I would like to hand it over to Tripti Tandon, a regional expert in Asia, to share her thoughts on the presentations and offer insights on what they mean for advocacy efforts in this region. Tripti is a practicing lawyer based in New Delhi and is associated with the Lawyers Collective, one of the oldest human rights law organizations in India. In her over 24 years of work, Tripti has spearheaded litigation, advocacy, and community engagement on health, law, and criminalization, especially in the area of drug policy. In recent years, Tripti has also worked as an international legal consultant, reviewing drug laws in South and Southeast Asia in support of efforts to promote health, harm reduction, and human rights-based legislative reforms. Tripti, we are very keen to hear your take on all of this.
Tripti, you're on mute.
Thank you, Unchisa. Thank you, Gloria. I'd like to congratulate all the previous speakers for their very informative and enlightening presentations from their respective jurisdictions. And I think we're very fortunate in Asia to have IDPC organize these webinars so that we can really learn and reflect from the experience of other countries. I want to just offer a few thoughts based on what we heard from our previous speakers, and just see where we stand in Asia, or what some of this may mean for drug policy reformers in Asia. I think the first thing is that as far as Portugal is concerned, most policymakers who have an interest in drug law reform in Asia have actually visited Portugal. So they've been on site visits to Portugal. They've seen the Portugal model. And, in private conversations, they say, well, they were pretty impressed by what they saw in Portugal. But also, I've heard policymakers say that this is not Europe, we are Asia, we are so-and-so country. Just look at the numbers of people who use drugs. What is Portugal and what is the extent and scale of drug use in our countries? compare the resources when nowhere near, compare social attitudes around substance use, the permissiveness that is perceived to be commonplace in Europe perhaps doesn't exist in Asia. So, this is one thing, that while it's good for policymakers to be exposed, but that doesn't really translate in, action locally in the country. The second point I want to make is that most of our speakers talked about drug law reform being preceded by significant harm reduction measures. And by harm reduction, I don't just mean the first generation measures like needle syringe and opioid substitution treatment, but also more recent interventions like supervised injection facilities or pill testing, drug checking, etc. Now in Asia, we are nowhere, we haven't moved the needle on this. Harm reduction still means needle syringe and opioid substitution treatment. And there's hardly any discussion on even, introducing some of these other measures. And the point is not lost on me that some of these measures were actually instrumental in, say, whether in Canada or in Portugal, in maybe generating data which helped push the needle towards decriminalization, or getting the community organized, mobilized, or just generally in terms of awareness creation and the need for a health-based response to drugs. I think we're kind of losing out on this, and perhaps some of us who are active in the field of harm reduction may want to think and strategize. Do we think about some of these second generation measures, or perhaps it's just not possible in Asia? The third point I want to make is that all the speakers actually had robust data sets to back their advocacy claims. They had evidence to show that this works or this doesn't work. There was also, after law reform, there was monitoring, evaluation in terms of this decriminalization has not led to an increase in substance use. It has not led to an increase in crime rates, etc. Unfortunately, in Asia, we don't have access to data. Our governments do not really invest in documentation, in data mapping, analysis, etc. And civil society really also, it's not possible for a lot of us to generate this kind of data set. So, countries like Thailand that have had, some level of drug law reform, or Malaysia or Indonesia, there's just no data to support reformers' claims, or to contradict what some of the anti-reform stakeholders may be saying. So I think we're really at a disadvantage on that front. The fourth point I wanted to just reflect on is in terms of quantity thresholds. Now, it seems whether one is discussing not full decriminalization, but diversion and alternatives to incarceration, or one is discussing decriminalization, as seen from the experience of the jurisdictions that we heard about, quantity thresholds are really central. If you meet the quantity threshold, you are likely to be eligible for, a decrim response or access to health services, social services, etc. Now, in my opinion, we need to rethink this dependence on quantity. And I think some of the papers from, Asian countries which have sought to, look at reforms, whether it's Thailand, whether it's Indonesia, quantity thresholds are really failing people who use drugs. The thresholds are very, very low, like one pill or, a few milligrams, as Thailand has incorporated in its 2021 drug code, or the fact that in my country, India, 5 blots of LSD is considered, trafficking quantity and subject to minimum 10 years in prison, or the fact that, often people who use drugs don't, like we've had cases where people say, I wanted to buy less, but the dealer said he's not going to sell less than this. This is the minimum amount that you have to buy. Or the fact that people who use drugs have been arrested while they are, conversing with somebody who has drugs, whether, in person or online. Or the fact that there's nothing, no drugs recovered from them, but they happen to be in spaces where there is use and selling going on. So just the sheer fact that everything rests on quantities perhaps needs a bit of a rethink, because it's not really working. The fifth point I wanted to make was that decriminalization means very different things to civil society and drug policy reformers as compared to what it means to governments and law and policy makers. I think our understanding of decriminalization is that a person who uses drugs or a person who possesses drugs for their own use should have no contact with the criminal justice system. Like their case should just not go to the criminal justice system or should not be processed. But I think policymakers in this part of the world really have this attitude that we can't leave people who use drugs alone. Like, what are you saying? We don't do anything. We don't have any response. We don't have any intervention. So it's sort of considered necessary that there be some measure, some mechanism, and that mechanism is usually rested in the police. Firstly, coming into contact with the police, and then the police deciding where your case goes. And secondly, in the compulsory treatment and rehab system. And I think we heard from previous speakers that the police have often been a hurdle in even realizing decrim goals, with the exception, of course, of Australia. And, given the research on drug policy policing in Asia, which you can see from IDPC papers, police corruption is really endemic in this part. So I think the way we visualize decriminalization has to, like, we shouldn't fall into this trap of, it's okay for some level of police involvement. It's okay for people to be sent to rehab, and we consider that as decriminalization. I think we need to be clear that that is not what we envisage. The sixth point I want to just highlight is that, and this I see from the experience from India and also Malaysia recently, where ideas around decriminalization were floated, and there was a lot of public debate and discussion around. Like, you had policymakers making grandstanding announcements that we're going to decriminalize drug use, and we're going to have a health-oriented approach to drugs. But I think sometimes publicity tends to activate the conservative forces both within and outside government. While I take note of the fact that there must be public consultation and involvement of people who use drugs and experts in any proposal, unfortunately, this sort of a lot of public speaking and grand statements in the press don't really help. Rather, they hurt the goal. So, for instance, in India some years ago, one particular ministry announced that it was in support of full decriminalization of people who use drugs. And there was an immediate backlash from other quarters within the government who said, no, this is just not acceptable. And that particular department's views were drowned down. And there was no change in the law. So I think one needs to be a little careful. And I know that, you know, there can be opposition to what I'm saying. There is a need for discussion and debate, but I think we need to strategize a little more carefully. The seventh point I want to really make is that while you know, of course, Portugal is well known in Asia, but Canada, Oregon, you know, the measure 1110 or what is happening in Australia, it hasn't had, like, people are not aware about what are the changes going on, and particularly policymakers. So I think the impact of reforms and progressive reforms in other countries is a little slow to trickle down and even slower to influence, like its impact is not felt that much. But unfortunately, news around rollbacks and backlash and, you know, governments going back on decrim, that kind of news spreads very fast, and that tends to you know, equip drug law reformers with you know, news and information to say, look, it hasn't worked there. So that is the regrettably the situation, that good travels at a snail's pace and bad, of course, you know, spreads very, very quickly. So just to, you know, conclude my last thoughts, that while for, you know, drug policy reformers like myself in Asia, while we continue to think about decriminalization, and I think speakers before us have said that it's necessary but not sufficient. So while we, you know, we take that point, but we also perhaps need to strategize around other mechanisms to reduce harms of drug laws. For instance, the reduction in penalties. So like our, you know, Chris mentioned that in Australia, that was another thing. It was not just decriminalization, but existing penalties were reduced. So that is one thing that, you know, Thailand has done, and we need to understand what is happening. Another thing could be threshold changes. So again, you know, not full decriminalization, but saying let's relook at the quantities. Let's really see, we you know, there's room to kind of raise the quantity thresholds and allow more people to, you know, receive less punitive or non-punitive measures. So I think we need to perhaps also strategize around these concepts. So I'll end here. Thank you. Thank you.
Thank you very much, Tripti. There's so much to learn from these diverse experiences as we shape our advocacy strategy in this region. And I hope we can continue bringing these important conversations to our governments, fellow advocates, and the wider public. And a big thank you to our 5 experts on this panel, including the video presentations. In the short time we have remaining, let's quickly turn to respond to the questions that have come through from the audience. We've got 3 so far, and I think we only have time for those 3 questions. We'll ask the speakers to respond briefly to them. And if anyone has any further follow-up questions, you can also post them on our the link to our Facebook Live as well. So the first question is for Chris. Regarding police engagement in the program, it sounds like there has been a lot of collaboration and sensitization of the police in ACT. Could you elaborate and share your observations, challenges, and with law enforcement, what it looked like in real time in terms of dialogue and engagement? Also, do you do training with the media and all others? Also, given the positive impact of the program, are there plans to scale up to other states?
No worries, thanks. So what it looked like with the police was, I think really importantly, one of the things that kind of allowed the police to talk to people who use drugs, and in particular CAHMA, was that the Uniting Church, the Synod of New South Wales and the ACT put forward a public statement that they supported decriminalisation. And so that had a really profound effect in terms of what the police thought about it, having that broader religion-based movement of people actually saying, these are our, families, our brothers, our sisters, so the police actually reached out to me at one of those events. The leader of the police, chief police officer, reached out to me, and we started a dialogue where we talked about, okay, how do we navigate our way through this? And so we worked together. We met throughout the reforms, and in reality, it was a top-down approach, because let's face it, the majority of people who use drugs, for them, the police are very, very scary. And for me, it was very intimidating to do this, And so really, I had to place a lot of trust in this police person that I was dealing with. And then they introduced myself and my team to the leaders of the police. So it was a very top-down approach. The police then went off and did their own training, but it was based on us sitting and doing training with the leadership of the police. And it was less training and more of a long conversation and a dialogue about getting on the same place. And in some places in some ways realizing we were different, but in a lot of ways realizing that we were actually the same. So that's kind of how we broke that down. The media stuff, yes, we do some training with, we engage really heavily with the media. We don't do any training with the media, but we certainly provide them with a lot of information about what language to use, what's going on, what harm reduction means. And we engaged really successfully with some of the more what we call shock jocks in Australia, which are, the police the media who aren't our natural allies, to actually make them realize what was happening. And so we weren't preaching to the converted, so to speak. We were talking to those people who actually thought that drug use is terrible and we should just lock up all drug users. So that was challenging, but it was quite rewarding as well. I mentioned some of the stuff that's happening in Queensland and Victoria and New South Wales. There are some moves. I think some of that was kind of a groundswell from what's happened in the ACT. I'd like to think that. And so really, I think one thing with advocacy is it's almost like surfing. You kind of, there's a swell from community and a chance of change, and you really have to ride that change while there's momentum and impetus to do that. And so that's what we're trying to do within Australia.
Very helpful response. Thank you, Chris. The next question, this could be for all the speakers to respond briefly. In countries such as the Philippines, which just came from a so-called drug war where thousands of people were killed, the challenge is in the slow legislation to decriminalize and adopt a health-centered approach. From your experience, how can reform get a head start in a situation like this? Maybe Joana can start first.
So I can speak from the Portuguese situation, which is totally different in terms already of human rights by the 90s before the law. But it started with a very top-down decision, like a group of experts joined, like sociologists, anthropologists, criminologists, doctors. So a group of experts came together and did the first, it was called the National Strategy Against Drugs. And it was putting people use drugs at the center. So looking at people use drugs by our biopsychological, let's say, side, and going beyond deviance and stating that crime was not being helpful, neither for the imprisonment system, either for the health of people who use drugs. So I guess here the point was to bring full rights of people who use drugs to the center and look at drugs from a very multidisciplinary view, let's say. And when it comes to Philippines, where the war on drugs was so impactful on humans' lives, I guess putting human life as the first value would be the first way to look at it. And I guess one of the things that Portugal can taught us through the experience of decriminalization, yet we don't have a full citizens, let's say, approach to people use drugs. That I think I told and I mentioned a bit on the stigma that is still prevailing. But one thing that maybe I would different from the night, we would do different from the night, would be the consultation of people use drugs in all stages of the processes, and even now in terms of evaluation of works and what doesn't work in the policy. Sometimes we take a lot to create new laws, but I think the try and error is also an experimentation that it's worth it in terms of drug policy. So for decriminalization, I can say that at the beginning in Portugal, there was like these surveys towards the acceptation of decriminalization as a policy, and around 60 to 70% of the people were against it. But then it worked in terms of public health. So nowadays, the majority of people are in favor of decriminalization. Let's say public opinion is in favor of decriminalization. And sometimes we need to have political willingness to change a situation. That comes first. And for that, we need to look at data, we need to look at other experiences, and this part of the traveling of the policies is a possibility, but we need really to look at the local and cultural contexts for not being biased also in the policies we import.
Thank you, Joana. Maybe I'll now pass it to Tripti to respond.
I think one is that each country has its own context, and the question is best answered by people from that country. So I don't know if we have colleagues from Philippines on the webinar and who may want to take a shot at the answer. But I think one thing that really stood out from Nick and Thesha's presentation was this aspect of public safety. So how that and the perceptions around that can really twist drug law reform in a totally different direction. So and given that whatever I've read about Philippines, there was a lot of homelessness and, people in certain communities that were targeted, the poor communities, working class neighborhoods that were targeted by the war on drugs. I think it would be important to have, consider that aspect, because perhaps the perception of the public in the Philippines is really like drugs are a danger to public order and safety, etc. So I think that would be important to bear in mind. And second, I think that that's something that Joana also mentioned, that human lives matter, whether they're involved in drugs or they don't. So that's sort of that's the starting point of any drug policy reform, that human beings, should be, their right to life, liberty, dignity, etc., must be at the center of any legal response that we formulate. I think that message should be clear.
Thank you, Tripti. I think Chris will share his response in the chat box since we don't have much time. So we'll move on to the last question. Again, I would like to ask all the panelists to give some brief response to this. Are we missing a trick as a movement for drug decriminalization, but not more clearly linking this apparatus with a broader culture of punishment against dissent and deviance? What opportunities may lie in building alliances on those grounds? Whoever feel like they can respond can do so.
I just want to say briefly here that I think yes, drugs and the response to drugs has to be seen as part of the larger picture around the criminal justice system and crime, punishment, what is acceptable, not acceptable, etc. But and it's important to build alliances. But at the same time, I think drug policies have certain peculiarities, and there are some technical aspects and some other, health and community related aspects which are very particular to the drugs movement. So I think that shouldn't get lost in trying to broad base and coalesce with others.
Joanna, do you have
Yeah.
any?
Yes. So basically, and this was a lot discussed during these 20 years of more than 20 years of decriminalization. For instance, the decriminalization policy was still based in a very prohibitionist background, from the point that people use drugs either with non-challenging use or would be always invited, or even when I say invited, sometimes is that rather invited or in terms of treatment or going to incurring in other penalties. So this has been a lot based not in the addressing full decriminalization of drug use, but most on preventing people to use drugs in a certain way, but from a very prohibitionist approach. So I guess when we address decriminalization, we have to also look to the punishment that is still occurring, and we need to work from close with this multidisciplinary approach from lawmakers to decision makers, but also including people who use drugs, because it's affecting our lives in the way the war on drugs is still here and is still a war on people, even through some decriminalization experiences. So I guess here we need to move further the punishment and address drugs regulation. Also because I think it's the only way to overcome the deadly overdose crises that we've been seeing through the world. And yeah.
Chris?
It's an interesting question. I'm not sure whether I fully understand the question, but I'll give it a go. So, look, I mean, I think it's an interesting one. It's about morals. So, in this kind of, this it's morally bad to do drugs, and I think in Australia, for example, in the 1980s was where the government had to kind of fund affected populations from who were at risk of getting HIV, and out of that, because they just had no idea how to do health promotion with people who inject drugs, sex workers, and men who have sex with men, and other LGBTIQ people, and the Aboriginal community. And so out of that funding came this really excellent solidarity and the unfortunate bit, though, is that we've seen real progress in Australia in terms of legislation around sexual preference. So in the 1980s, almost ubiquitously across Australia, it was illegal to for men to have sex with men, for example. Homosexuality was illegal. We are now in a position where we have same-sex marriage, and we have discrimination laws that kind of, although it does happen, and sexuality is, some people are still discriminated against. The legal frameworks have really caught up with the social fabric of what we expect in our society. To a lesser degree, it's happened with sex workers. And we've got decriminalisation in some jurisdictions and legalisation in other jurisdictions. It's kind of a mixed bag. Drug laws have been the population for which the community where we have seen the least movement. And why is that? I'm not sure, but I think if I look around now at the people, at the youth especially, I think there is something about laws needing to reflect society and what society's values are. And I think the values around what a person who uses drugs looks like in society has changed radically in that period of time. So I think, legal change is really necessary. How you make that happen is really, really difficult. I did just have a thought as I was sitting here looking at, and it was just about, we did have success with the Uniting Church and utilizing religious moderates, not in religious contexts, but as allies. And so I think there is something to be said about champions outside of our community, especially in countries where it is so highly criminalized. For example, large parts of Asia, where you can't, or you need to protect yourself. It's difficult for me to be a peer in Australia, but in the Philippines, then that has, significant and life-threatening difficulties. So I think the first thing is, everybody in this network is just amazing and vibrant and brave. But I think we also need to balance the risks in terms of ourselves and lean to some extent on our allies across society to help us and to provide safe platforms for us to speak and to lead from.
Thank you. Thank you so much, everyone, and especially to all the panelists. And yeah, we already ran over time, but thank you everyone for staying with us. So yeah, thank you for joining us today. We hope the insights shared will inspire meaningful action in your work and communities. One last thing on the topic of drug decriminalization, IDPC also offers a free online course open to anyone interested. It's designed to support and equip partners worldwide in advocating for drug decriminalization. Additionally, IDPC has developed a gold standard for decriminalization, which includes the removal of all forms of punishment for activities related to drug use, among other key principles. We will share the link to these resources in the chat, so be sure to check them out. And we encourage you to continue reflecting on today's topic and to stay connected with us as we delve deeper into related issues. Be sure to join us for the next webinar in this series. Until then, thank you once again, and we look forward to seeing you at our future events.